Good Wednesday morning, everyone. I am Jen Bordeaux, and this is another segment of Family Law Uncorked. It is June the 17th. I've been saying the date since I started doing these 3 months ago. So hopefully, if nothing else, this has helped provide a calendar for you throughout COVID and quarantining at home and all that good stuff. So today's segment is a little bit different. The guest is near and dear to my heart. I am blessed enough to call her my best friend, and she is sweet enough to share some of her time this morning because Lord knows she is busy between being wife, nurse, friend, and she's a mom of twins. So life is fun and busy for Jetta for sure. So Jetta McGlone is my guest today. We've known each other for several years, and it's fun whenever you get to work with your best friends. So Jetta, thank you so much for joining me today.
Thanks for having me.
And our focus today is, COVID has obviously been going on for quite some time, and in America, and specifically to our state here in North Carolina, it's been, we really transitioned to quarantine mode back in mid-March. And so as things have started opening up and there have been other focuses in society, rightly so, I think people have kind of forgotten a little bit about COVID, but COVID hasn't gone away by any means. So we wanted to kind of bring in some people from the front lines, some of our community heroes that have been out there battling COVID for all of us, and have them share their experiences. And who better than someone that has been on the front lines in the capacity of a nurse to come in and share her story. So again, thank you for joining me. And
thanks for having me.
And because I know since I've known you, I can share your story a little bit. You went to nursing school, you worked in trauma ICU for a while. Before that, you worked in the emergency room in Charlotte. And then your nursing journey kind of took you on a different path to aesthetics. Okay. And then you found yourself back in working in ICU. So tell us a little bit about the journey of going from aesthetics to ICU for COVID, what that was like, how you came about that decision.
Yeah, so right before, the whole pandemic hit, I was on maternity leave, and I found myself returning back from maternity leave, entering into this crisis. I was then employed, and then I was, opportunity came up, and I was seeing a lot on TV, nurses, leaving 18-hour shifts, and as a nurse, we never want to hear a fellow nurse, working over 20 hours in really horrific conditions. So I decided I got a contract from a nursing recruiter, and it didn't matter at this point. They just needed bodies and nurses to help. So once I got the opportunity, I didn't even ask my husband. I just told him I was going to help at that point. I wanted to, how often do pandemics happen, and
hopefully not very often.
Hopefully not very often. So I really just wanted to go and help, the numbers that we were seeing on TV and the images that we were seeing on TV could not, depict what was really happening up there. And so I just wanted to do my part, as a nurse, and help support, those women, doctors, nurses, they all needed help. So I just found myself on the first plane to New Jersey.
Yeah, which was awesome. I remember whenever we did a Zoom happy hour with our corporate friends, and I guess the night before you had texted letting us know, and then whenever we had our happy hour Zoom with friends, we kind of dove into it a little bit more, and obviously we all had so many mixed emotions because we love you, and so we were so proud of you. Oh my gosh, so proud, but also concerned. So I can only imagine, how your family felt as well. So once you had made that decision and it was time to go, what was that like? Because I know, the boys were 5 months old at that time.
4 months. They were 4 months old. It was one of those things I kind of leaped and jumped before I really kind of examined my thoughts and my feelings. But once I sat down and I started to tell my friends and my family, you have that moment of, what am I walking into? And just being really nervous. You go through all of those things of, am I good enough? Am I going to be able to help? Am I going to make a dent? Are my kids going to be okay? My husband's going to have to raise 2 kids for 6 weeks. Lord, what is that going to look like? But I'm so thankful to have amazing friends like you, to just step in, and just kind of pick up, where, we needed the help. It wasn't an easy decision because I kind of just did it. But once I had, committed to it, it was, for me, it was no backing out. It was, okay, you're going to go up there, you're going to do this, and you're going to get home. Just kind of, it was a thing that needed to be done. You need to do this, get it done, get home, be safe. So
that's awesome. I mean, I think the courage, because I know we had a couple of conversations about it, and I could hear the excitement in your voice for sure, and being able to switch back into the hospital role or the hospital environment. And I remember you saying specifically, like, you just had a calling to get back in there. You had the experience, the credentials, the background to be able to play a direct role in helping during the pandemic. So I remember that. And then, and us talking about that. And then I remember taking a step back and I was like, okay, I love all of this courage and initiative and being motivated. And I was like, how is Mom Jetta doing doing with this? And I remember you on the phone, just taking a deep breath and kind of had a little break in your voice, which is completely understandable. And you were like, it's going to be hard, but, I hope that when they're old enough for me to explain this to them, they will understand that I did this for them, and it was an example of how to contribute and everything, which just warms my heart. I'm getting chills over here just thinking about that conversation. So thank you. I think I can speak for a lot of people in our community and saying thank you in the sacrifice that you and your family made for those 6 weeks, because we kept in touch all throughout, and I know it wasn't easy at all. So
they were long days, very long days. But you're absolutely correct. When I made this decision, I told William, I was like, I can't wait to tell them like what their mom did, when you have kiddos, all you want to do is make them proud. And so I can't wait to sit down with them and to kind of have this discussion about, hey, like, look what your mom did, So I did this for them, for other moms, so they could see their children and sisters and brother, it's so much bigger than just me. That's
awesome. It's just like your footprint, on the world, because this will undoubtedly be a mark, a couple chapters maybe in a history book later on down the line. So it's like you're leaving your footprint there and your legacy for the boys and for other people to see. So I know that's got to feel good, as scary as it was, and I know it's done, and we're going to backtrack here in just a minute about what the actual experience was like in the unit. But I think that's awesome and so commendable, and for all the others that are doing it as well. It's just we get used to our day-to-day routines, and that these other people are out there, in the medical field doing all of this stuff, and we just get to carry on with our lives, kind of like soldiers battling the front lines, in other scenarios. So thank you. So now let's move to actually getting up there. So you got up there, you had your Airbnb, and you were at a hospital in Newark, New Jersey. And you were in the ICU, is that correct?
The medical ICU, yes.
Okay. So just kind of recap, and I know that it was I remember you just talking about how tired you were and how crazy it was. I mean, the stuff that was portrayed on TV was somewhat accurate for once. So just walk me through that experience, because I know you also, even though you had experience in the emergency room and like trauma ICU before, it had been a few years, and then here you were jumping into like a crazy situation of being a nurse back in this scenario. So what was that like for you?
I quickly, very quick, it's like riding a bike. You'd be surprised at how quick a lot of these things came back. Well, I was surprised at least. They gave us about a 6-hour orientation. And had I been in scrubs and Dance Goes nursing shoes, I probably would have taken assignment the very first day. Thank God I wore my flats that day because those were not safe to work in. I actually got up there at a very interesting time. The unit 3 to 4 weeks prior had seen the largest numbers of deaths. And I think I actually spoke with one of the nurses who, it was her home unit. They just weren't prepared, and they didn't understand, they didn't understand how this disease would affect, everything. I think in the very beginning, they were just grabbing everything that they could. I don't think they had a chance to prepare, isolation rooms and to do account with PPE and masks and to make sure, and to kind of set up a policy almost in place to preserve PPE. Once I had gotten there, they had done a really good job at assigning everyone bags with just personal PPE, and that bag was your bag for that shift. It was a group of seven of us who were taking assignment. And just to see them when we walked through that door, they were like, "You guys are here to help?" And we were like, "Yeah." Some of these nurses had, paid time off, or they were actually calling nurses from float pools in different hospitals. So just to kind of see us when we got there, how relieved they were to just have extra hands on board. These nurses were taking 2 to 3 patient assignments. Sometimes even they were even asked to take 4 patient assignments. And if you don't know anything about the medical ICU, it's a very intense unit. The normal ratio is sometimes 2 to 1, so that's 2 patients to 1 nurse. So then these nurses were asked to take double. So you could just see the relief when we got there. And then that's when it really hit. You're like, oh, okay,
this is real.
This is real. This is happening right now. Something that we've never seen in healthcare. It's just it's very different. Very eye-opening, and like, oh, okay, this is where we are. So yeah.
Wow, it sounds so intense, and I know just being able to follow along on social media, and your different images of you like all suited up, head to toe, and the masks and the marks that it would leave, so it really brought it home for me because I had a person that was actually going through it. I mean, my parents are both in the medical field, but they work in clinics, and so yes, they've been masked up for sure, but not nearly as intense as a medical ICU unit for sure. So was it scary? I guess it's just a question, like being on the unit, did you stop, or did you even have the chance to stop and think like, I am face to face with these people that have COVID, have this potentially deadly virus?
I think healthcare professionals, we sign up for a lot of things. And so it's one of those things you really don't, it's kind of, you have a job to do, and you don't really sit back and just kind of examine. You have a sick patient, by any means necessary, do you do what you have to do to help that patient and to get that patient better at home? So unfortunately, I didn't really have the time to just sit back. When I got there, it was one of those things, you suit up. You make sure you have all the PPE that you can. You protect yourself, and you are smart. I do remember your mom saying, slow down. And that was the best advice, because sometimes in healthcare, we are just so used to moving so fast that you might not, put on an extra face shield just because you're trying to run into that room to help. So that, having that bit of advice, helped me the most, because I was able to just, okay, wait a second, let me slow down, let me get what I need before I go into that room. But yeah.
So you just, no holds barred, just go in and do what you got to do. But I mean, that's necessary. Because if you took the time every time before you walked into a COVID patient's room and were like, I might get the virus, it wouldn't. That's going
to impede my level of care that I'm providing. Absolutely. The whole unit was COVID. So when you came onto the unit, you were already gowned down in your protective suit. So they were allowing us to kind of wear Tyvek suits, painter suits. So we were wearing those with gowns, goggles, face shield, gloves, shoe booties. So you were already dressed before you hit the unit. Did I answer your question?
Yeah. Yeah. So was it all, so you said it was a COVID unit. So does that mean that all of the patients had been
every single patient, yes, had either been admitted from the ER or directly to the ICU unit and, required that, intensive care bed. Yes, so every single, actually the whole hospital, there were 4 dedicated floors that were COVID positive floors. Yeah.
Well, I mean, that just tells you the influx of all of these patients that have been, to take a hospital that normally obviously doesn't have a floor designated for COVID patients to have 4 floors. And I know from what you've expressed before in other conversations, I mean, and you were busy nonstop. I mean, from the time that you walked in there until your shift ended, which a lot of times was longer than 12 hours. It was nonstop. So I think another thing from your perspective, because we talked about this whenever you worked at the trauma ICU in Winston-Salem, and you had the responsibility sometimes, or the burden of letting family members know when it might be a good idea for them to come in and kind of prepare for goodbye, so to speak. And not that I want to be a Debbie Downer or bring the mood down, but it's a very real part of some of these, units that patients are in. So with switching to this medical ICU unit being a COVID floor, that had to be very different, because, and it's been one of the most heartbreaking things for me to see and to hear stories about. And I'm very blessed and fortunate to have not directly experienced this, but to have someone that is very ill and you don't know what's going to happen, if they're going to recover from this. And you also can't go see them. You don't get the opportunity to go say a goodbye. And so in my mind, it seems then that and we've heard stories of nurses acting as that patient's biggest support, as well as the outside family support, because they can't access them. So I can't imagine, but what was your experience with that?
That probably was the hardest part. I think having to have those conversations with family members are really hard, and it's very difficult. One story sticks out in particular. It was a mom who just didn't feel well and just wanted to come to the emergency room and be seen. And she hadn't heard, and so the family was calling. I think she told one of her children that she was going, but she didn't notify them as to which hospital she was going to. So this poor family was left to calling around the city, trying to find, their mother. And then to hear for 5 days that she had been in the medical intensive, the ICU unit, and they had no idea what was going on. So, having those conversations with family members are definitely the hardest part. And then with this disease, it's something that we don't know a lot about. So to kind of, when you go to the hospital, you're like, okay, what are we doing? What's happening?
Give me answers.
Give me answers. And so a lot of these questions that some of the family members had, we didn't have answers to. We did start to implement kind of FaceTiming family members, but of course you're in the ICU, so it's unfortunate that family member is not able to talk back, but they're at least able to lay eyes on that person, and be able to make kind of informed decisions about, really kind of see what's going on. It's really hard to kind of make a decision that you are not able to see. So once we're able to kind of call those families and just kind of get in there and just kind of show them their family member, they were like, oh, this is what's we had no, they would have no idea. That was the hardest, I think, towards the end of my time there. The doctors had made decisions to allow one person from the family member, if they were not doing so well, to come in and look through the window to kind of say their goodbyes.
Bless. Woo! That's like...
So imagine not even being able to touch or see or feel or say that, say what you want to say. It's really hard. It was really, that, like I said, was the hardest part, and it makes it that's what made it real for me. Like,
Yeah.
oh, like she's not going to be able to say I love you or say goodbye. And there's a whole nother, this is something else that you don't really think about is, getting that person, once they are expired or do pass away from the hospital, because we were seeing such large numbers, and that trying to find that family member and that loved one. Funeral homes directors were being so overwhelmed. That system's completely overwhelmed. There are people still searching for their family members.
Wow.
So it's something that we've learned a lot from, but it's very hard to witness firsthand.
Yeah. So I just think about someone like yourself in the position there as a nurse and doctors and even mental health providers as well, and that not only are we dealing medically with a virus that we obviously have, they've been working around the clock and researching and trying to, to learn more about and, drug tests and things like that. But then these roles that, nurses, doctors, therapists, things like that, that are already in intense roles of caring for other people have now been called upon at another level of this being that support. I mean, nurses have always played a role of support, obviously, both, medically and just, I think, just emotionally in certain situations. But this is a whole nother level. I mean, that's, to be that bridge between the patient who's experiencing this and the family, it's just a whole nother level of the care that nurses are called upon to provide right now, as well as some of these other roles. So it's just, it's crazy, and it's necessary. And it's just, I don't know, that I could say thank you just 1,000 times. And I think I speak for a lot of people in saying that. But so we've gone through that and you've had this experience and now your 6 weeks is wrapping up. Did you see a change in the hospital? I think we touched on this a little bit just through random conversations, but as far as the number of patients there, had it changed at all in that 6 weeks you were there?
Yeah, so interesting. So I had got up there April 12th, and my last shift was the week of May 18th. So my last shift was at the 22nd of May. Absolutely. In that 6 week time, I saw those first 3 weeks, it was just chaotic. It was something that was happening at all times on that unit. We started to then, I think the governor of New Jersey and New York, they had been already on lockdown, and kind of the stay-at-home order had already been in place for a couple weeks, and we started to see the levels just kind of less volume in the emergency room. Then more testing became available, so then we had another little spike. However, the admission levels to the ICU about my last 2 weeks were down significantly. So we were seeing patients. We were seeing that the stay-at-home order was doing what it needed to do, and the spread of the kind of disease had kind of come to a little bit of a standstill. Now, I don't want to say like no one was being admitted at all, but those large volumes in which we were seeing those admissions started to decrease, which was what we wanted.
Right.
So yeah, that makes you feel so, you're like, yes, okay, we're making a dent in this. It's not even like a we, it's the community as a whole, the elected officials, they're the ones who are getting these numbers from the hospitals and running these numbers. And we're starting to see a little bit of not a flattening. In Jersey, it's very different. It was a little bit of a kind of a plateau. Let's call it that.
Yeah.
So that was really awesome to see and just kind of witness that change within.
Right. It's like a small validation for the hard work that everyone's putting in and people staying home and trying to take precautions. So on that note, and I don't want to take up too much of your time, so I just wanted to get your thoughts on this. With that, as you know, here in North Carolina, we have been in phase 2 of reopening and looking at phase 3 here very soon. But more recently, and specifically to Raleigh and some surrounding areas for North Carolina, there's a lot of talk in the media about making it mandatory for people to wear masks out in public, because up to this point, some stores individually would require them or have been requiring them and have been requiring staff to wear them, but it hasn't been a widespread thing. And there, are people like everything that sit on, two sides of the fence of, no, you can't, don't make me wear a mask, or you can't make me wear a mask, or yeah, everyone should be wearing a mask and stuff. So what are your thoughts on that after being, in the front lines of treating COVID patients in ICU and seeing people, unfortunately, succumb to the virus and not recover? So what are your thoughts on that?
I applaud, the businesses and the mayor and governor who are still really kind of fighting for this decision to make it mandatory. I understand people have a right not to wear a mask, but as a community, we also have a right to keep our community safe. And if you want to, the best way to keep the community safe is to wear a mask and to distance yourself and to practice good hand hygiene. That's the only way, we're going to really help kind of or succumb this disease. We don't want the continual spread to happen. And I think it's everyone, we just have to do our part. And I am I'm completely for everyone, wearing masks. I think it's very important that we don't, because it's very easy with things opening up again. It was a big eye opener for me to get off that plane and to come home and to walk into, I believe it was, I believe it was Target.
Of course it was.
Of course it was Target, right? And to see people just not wearing masks, I was like, what are you doing? This is real, so I just wanted to show people listen, this is what's happening, but I get it. People have their right. I just know for me and all my friends, I'm wear a mask, wash your hands, but it's very, we're in the South and it's very different. And thank God we do have a lot of space. But we all have to do our part, it's going to require everyone doing their part. So it's going to be very interesting when things start to fully reopen again, and what that's going to look like. It'll be very interesting.
Yeah. I think, because I've seen people, I think this is a common misnomer. I've seen people make the argument of, well, I haven't been wearing a mask and I'm younger and I haven't gotten sick. And so in talking to my mom, who's also a nurse, when you're wearing a mask, really you're wearing it to help other people. And that's helping to keep, if you were to cough or sneeze out in public, that you're not coughing on something or you're not coughing on someone else, or the little particles aren't floating out in the air. So while it's awesome that as an individual, said person or people that feel that way have not gotten sick, that's not really the full reasoning behind a mask. It's so that we all do our part to help prevent the spread of it. And I think it's really going to come down to, because of businesses, if they have to choose between making it mandatory for patrons to wear a mask in their store or to be closed, I have a feeling they're going to make the mask mandatory.
They're going to go for the mask.
Stores, because they've had to be they've had to have been closed for the last few months. So it'll be interesting to see how all of this unfolds. And I agree with you. Everyone has their right. But just in my humble opinion, for whatever it's worth, if you're not willing to hopefully do a small part, then just don't go out.
Don't go out. Right.
It's kind of where we are. It's a reality. Does it suck? Yeah, it does. But it's a reality of, if we want businesses open and we want to be able to go out and go on walks and, maybe even go to restaurants and social distancing. But if you have to wear a mask for a little while, then
why not?
That's better than having to be stuck at home. So
exactly. I'd much rather wear a mask in public than to be stuck at home again for the next, 2 months.
Yeah.
So yeah, my uncle just recently got diagnosed with COVID yesterday. And so his employer, they were not mandating, their employees to wear masks or gloves, and his whole entire department has all been out, and I kind of thought about that yesterday, and I said, as an employer, why not protect your staff? If you want to be open, let's go about this the right way and the smart way, and let's protect everyone we can so we can be open. I'm sure they're not as productive with 10 people out, with the COVID diagnosis as they were with full staff, so I'm just,
it'll be interesting to see how it unfolds and how, and that's what makes the world, colorful and interesting, is that everybody has opinions
as the world turns.
Absolutely. So, well, thank you so much for joining me today and sharing your story. And
thanks.
It was fun. I got to work with my bestie. So
I know.
Any parting words for those watching and still battling, obviously, with the thoughts and struggles around COVID and how it's changed the world?
Yeah, because we don't know a lot about it, it's scary. It is, but don't live in fear. Be safe, be smart, and just wash your hands. That's literally that's like my best advice. To anyone. We're gonna come on the other side of this. I'm strong. I believe us as a nation, we're gonna get over this. But we just gotta be smart, and we gotta be responsible, and don't live in fear. We're gonna be okay. We're gonna be fine.
And clean, not mean. Still, love your neighbor and be clean, and love your neighbor from a distance, but be clean, not mean. We're all going through this together.
I love that. Be clean, not mean.
So, well, again, thank you so much, not only for joining me, but for the direct role that you played in that. And now it's so exciting. You're switching into labor and delivery, and you're going to be meeting all kinds of new babies and helping moms.
Oh my goodness.
Working in the medical field. So
yes.
So again, thank you, and for those watching, thank you for tuning in. If you have any follow-up questions, of course, you can hit us up, New Direction Family Law, at any of our social media avenues, or directly from our website, or go old school and call the office. So again, as your friend, and I know just being a mom and a wife and a daughter and a sister and a nurse, thank you for all the roles that you have played and the sacrifices you and your family have made. And
thank you.
I will see you
Jen.
soon.
Sounds good.
All right.
Bye.
Bye.